This presentation will introduce you to the Professional Electronic Portfolio. In your Blackboard Nursing 377 course in the Unit 1 folder, you'll find information pertaining to the E-Portfolio. Open the E-Portfolio folder and the E-Portfolio Information folder, and here you'll find E-Portfolio Explanation and Guidelines with Example Item Rationale. This document provides a definition for the E-Portfolio, including the purposes and goals of this assignment. Essentially, the Professional Electronic Portfolio, which we also call the E-Portfolio, is just a collection of items and information that describes who you are as a nurse. It's more than just a resume. In fact, you'll include your resume in the final E-Portfolio that you submit in Nursing 423. The difference is that while a resume presents a summary of your nursing experience and skills, the E-Portfolio provides evidence of that experience and those skills. Our nursing program is subject to accreditation regulations by organizations like the National League for Nursing and the American Association of Colleges of Nursing. One of the ways that we show these organizations that we live up to their standards, so to speak, is through student e-portfolios. The e-portfolio correlates directly with our BS program outcomes, which I'll discuss in more detail later. And our program can show that each student is meeting these program outcomes based on the things they include in their e-portfolio. And this helps us demonstrate that we deserve to be accredited. And that's important to both us as an organization and to you as the student, because we must be accredited in order for your degree to be meaningful. The e-portfolio is also personal. It not only provides a record of your nursing activities and skills, your knowledge, and your achievements, but it also demonstrates growth. Because the e-portfolio is developed over time, it allows you to see how you have evolved as a nurse. And the e-portfolio is a great way to showcase your accomplishments because it includes evidence for every claim that's in it. For example, if I claim to have developed cultural awareness, I can back this claim up in my e-portfolio by including a project that I did for transcultural healthcare. The e-portfolio itself is the complete document, and within the e-portfolio, you'll include items and rationales. An item is any meaningful work from a nursing course, although you can include other things in your e-portfolio from courses outside the nursing program. This item can also be called an evidence. You may also hear it called an artifact, or some instructors may simply refer to it as the e-portfolio. But this can be a paper, a project, an experience, or any other assigned work that meant something to you. The rationale is your justification for choosing a particular item. The rationale explains why you've included that assignment in your portfolio and what you learned from the assignment, and also how you'll use what you learned from the assignment. Back in your nursing Blackboard course, in that same document, you'll find a rationale guidelines, which is on page 3. That explains the basics of writing your rationale. And you'll also find on page 4 an example rationale. And this is a template that you'll use when you submit your item rationale. Just delete the example part at the top. In addition to these guidelines, you'll also find an e-portfolio rationale rubric. And this rubric describes how your rationale will be evaluated. And remember that you have to have at least an 8 out of 12 in order to pass the assignment and to pass the course. You'll have as many chances as you need to revise and resubmit your e-portfolio rationale until you pass. There are 6 concepts that we emphasize in this nursing program: professionalism, informatics, evidence-based practice, critical thinking and clinical reasoning, leadership and interdisciplinary teamwork, and communication. We call these 6 concepts our core strands. Each level of the program, meaning your 100, 200, 300, and 4-level classes, has its own objectives within these core strands. If you go back to your 377 Blackboard course, you'll see that document listed as Level Outcomes and Program Objectives. And this outlines each of the course strands and the level objectives, freshman, sophomore, junior, and senior or BS outcomes. The level objectives identify the behaviors, the skills, and the knowledge that we expect you to have by the time you finish each level. Your interim e-portfolio, the one that you'll submit in 377, has to contain items from the 100, 200, or 300 level courses. If you're an RN to BS student, you'll only have items for the 300 level because you didn't take any 100 or 200 level courses in this program. By the time you complete the nursing program, you should have an item with a rationale for each of the BS program outcomes. The BS program outcomes identify the behaviors, skills, and knowledge that we expect you to have by the time you graduate. After you choose the item that you want to include in your e-portfolio, reflect on the meaning of that assignment. Ask yourself what you learned from doing the assignment, and think beyond the obvious. Then find the course strand that fits best with that assignment. For example, if I did a project about improving medication compliance among diabetic patients, and I had to search the literature to find the most effective ways to do this, I could use the evidence-based practice course strand. If I wrote a paper about SBAR, I could use the communication course strand. If I created a website that offers health information and teaching for health consumers, I could use the informatics course strand. Read the level objective that corresponds to the level in which you're completing the item to help you make that decision. Now that you've chosen the item and the course strand that fits best with that item, you have to write the rationale. The rationale is your justification for including this particular item and why it fits with the course strand. First, recall all the things that you did to prepare for and complete the assignment. How did those activities change you or influence you? Really reflect on this. Next, think about all the ways the assignment helped you grow. For example, if you did a project like the one described earlier about educating a diabetic client, chances are you learned something new about diabetes and diabetic medications. You probably also learned something about patient education. Perhaps that client was a teenager, and the literature you read helped you learn that teenagers learn differently than young adults, so you had to cater your teaching to the learning needs of that teenager. Not only did you learn how to teach a teenager about diabetes medication, you also demonstrated patient-centered care. And to find all this evidence-based information, you used informatics skills. This all helps you justify that you have become competent in the course strand that you chose. Now, your justification should speak to that specific course strand. If you chose evidence-based practice, your rationale needs to show that you are competent in the level objective for evidence-based practice. This means that you wouldn't write about professionalism. Also, you shouldn't just give a recap of the project. That only explains what you did, not what you learned. When writing the rationale, remember to be succinct. You have only 500 words to explain yourself. It's also important to be professional. Think of your audience as a group of professional nurses. You want to put your best foot forward, especially if you decide to use this portfolio during a job interview. Just a few more things about your e-portfolio. It is never complete. You should add to it throughout your career. Remember that the e-portfolio and the e-portfolio rationale are two different things. The e-portfolio is the overall product. Each rationale is just one piece of the e-portfolio. Your interim e-portfolio is your in-progress version of the portfolio and will be submitted in Nursing 377. The exit or final e-portfolio is the version that you'll have upon graduation, with one item and one rationale for the senior level objective in each course strand. Also, in addition to the items that you include from the nursing program, you should also include anything that demonstrates your achievements and your knowledge. For example, you could include certificates from continuing education programs, you could include letters of recognition, or include copies of any tools or protocols, manuals, etc. that you've developed in your nursing experience or career. If you have any additional questions or need additional help with the ePortfolio, please see your instructor.